an ex it's like being able to have an extended visit with, you're not my patients, but you're my friends. And one of my mantras is, as a nurse practitioner, I like to talk to people before they become my patients. And it's February. Obviously, Valentine's Day just passed. It's Black History Month. It's also Heart Health Awareness Month. So, very much aligned with that theme. Our topic for today is Know Your Numbers. And we're going to put a focus on heart health. So again, welcome to everyone. Thanks for joining. Let us know in the chat box where you're joining us from. And if you have any questions or comments, things that you'd like to address, please put them in the chat box, right? I'm not sure if you're using chat box or Q&A feature, but happy to answer as many questions as I can. If I don't see it right away, please don't take it personal. I'm probably just so focused on the content. I promise we will go through those before the end of the presentation. So thank you, Strat, for the lovely presentation, lovely introduction, and then also to AARP for allowing me to have this time with you once a month. All right, are y'all ready? I'm ready. Now, disclaimer, obviously I am a board certified family nurse practitioner. I've been doing healthcare for over 25 years. So yes, I am a legit provider, but for this presentation, this is information. I'm giving you information to help empower you to then have conversations with your healthcare provider. Please don't make any drastic decisions without consulting with your healthcare provider because Nurse Alice said this. Now, while mind you, exercise and eating healthy you can never go wrong with that. But please, before you go adjusting any plan of care that you have, please consult with your healthcare provider. This is for information purposes only, but empowering information to help you make healthier choices. Okay, again, me, family nurse practitioner. A majority of my, well, I work in the emergency room, so hopefully I don't have to see y'all there, right? But I also do family practice. I've worked in critical care. So I've seen everything from prevention to the actual trauma, injury, the outcome that we most want to avoid. So I'm very passionate about the work that I do. And long story short is my father died of cardiovascular disease in the emergency room while waiting. So as a young child, I have always been inspired to talk to people about taking control of your health, being an empowered advocate, and knowing, being able to identify what is you know and don't be afraid to ask those questions because your health depends on it. And I'm, for those of you in the Los Angeles area, NBC medical contributor, so you've probably seen me on TV. My hair is done up a lot more, so I'm trying to be more natural. But anyways, I'm so pleasured and delighted to be with y'all. So heart health, it matters, right? We just talked about it. Now, while February is Heart Awareness Month, that should not be the only month that we focus on our heart. Obviously, I'm a little biased, but the heart, I believe, is one of the most important organs of our body. Without it, we can't function, we can't live. It is responsible for so much. Now, we can't see it, so sometimes we may not give it as much, we may not give as much credit or value it as much as we do until something goes wrong. So this is the time to really appreciate all the um, thousands and millions of heartbeats that our heart does every day, every moment, every second. When we're sleeping, your heart's working. When you're enjoying yourself, your heart's working. There's never a moment where your heart's not working until our final day here. So it's really important that we take care of our heart. And as we know, heart disease is the leading cause of death amongst women, amongst men, across the nation, and actually globally. Um, and here's the thing, heart disease largely is preventable. And if it's not completely preventable because of genetics and things just out of our locus of control, there are things that we can do to help minimize some of the damage, put off some of those things that may be inevitable, and we can do that. But part of that is knowing what those things are and actually understanding how valuable those things are. Some people might say, "Oh, we've seen it all. Oh, it's just one meal. It's not going to hurt you." Well, it's not. One meal is not. But when you have that same type of meal every day, over weeks, over months, over years, it's going to start talking. Your body's going to start talking to you. So it's important that we have this conversation about health. Our goal here is to stay healthy, active, and independent as long as possible. All right. Okay, here are our objectives. These are the things we're going to cover today. But if there's something that's not quite on here, but loosely related, please feel free to ask the question. Happy to answer as much as I can. But part of the things is really understanding what our heart health numbers mean. Listen, when you go to your doctor's office, your nurse practitioner, your PA, whoever you see, they're gonna throw around numbers. I mean, most of us are familiar with blood pressure and your heart rate and those type of things, right? Your oxygen levels. But then it gets into labs, and there's some other numbers. You're like, wow, what's that? And most of us are content with, is it good? Is it bad? Do I need to worry? What do I gotta do? Right? But we really want to empower you because sometimes there can be a range of what's healthy or normal. And that's in kind of like a random large pool of people. But what's normal or okay for one person might be a red flag in someone else. So it's important you know what your particular numbers are. We'll learn more about why blood pressure and cholesterol matter so much, and how those small choices, yes, those small choices can make big health benefits. And we'll talk about how to monitor your health with confidence also, because sometimes, and I've been on both ends as the patient and as the provider, and even as a family member going and a friend. Sometimes it can feel like you're going to talk to the principal and it's like, don't don't talk unless spoken to almost, right? You feel like you need to impress your provider and say all the right things. And this is the time where we need to have trust with our provider, be honest about what we're doing, and have a real honest, like, hey doc, don't sugarcoat these numbers. What does this mean? Like, I know you're saying, oh, your heart's still healthy, but okay, it's still healthy, but are there red flags? What should I be doing so I stay here? So, being able to have those conversations with confidence and not feel like you're bothering your provider. This is your health. This is your life is on the line here. So in that, help you feel more prepared to talk to your provider about screening treatments and what your numbers actually mean. All right, poll time, poll time. Let's start with what you know. So, quick question in the chat box, and you don't have to say what it is, but if you want to, that's fine too. How many people on here know what their average current blood pressure is? Just curious. Let's see. What are we saying in the chat box here? Yes, yes. Okay. All right. Yes. Okay. Good. Yes. And that is good. So sometimes when you go, I would encourage y'all to do this because we think, oh, it's my blood pressure. I'll remember it. And then when you're asked to recall it like 3 weeks later, you're like, oh, what was my blood pressure? Whenever you go to, whether it's the retail pharmacy where they have the machines where you can take free blood pressure, you're going to your provider's office, sometimes they give you a printout and it has your blood pressure on there. You should track that number. You should keep that.
Yeah,
There are apps, there are free apps out there that help you track your blood pressure. And it's good to know that. And the reason being is because let's say you came into the office and you had a high blood pressure, and I'm like, oh, what does your blood pressure normally run? It's good to have that information. So in that split second, myself as a provider, I can say, oh, that's not your typical, like it actually provides some urgency. Not that a high blood pressure alone wouldn't provide that urgency, but if this is somewhere where your blood pressure is normally high, then I might think like, okay, what's been going on? What in our treatment plan hasn't been working? We really got to change something. So it's good for you to know. It helps give the providers more information on, is this a new acute problem or is this something that's been chronically happening? And if it's chronically happening, that may lead us to think like, I got to worry about some of those more heart disease. So if one, high blood pressure is not going to cause heart disease. Years of high blood pressure not managed will, uh, I'm more concerned for actual heart disease at the present. So understanding, knowing what your blood pressure is and asking from the provider, is that high? Is that low? Is that normal for me? Please look at my trends. Please ask those questions. And then also, because I know it's going to happen to you, because if I feel this, I walk away with more, if I could say maybe the word relief of knowing like, okay, I'm tracking and trending what's happening with my health, right? And we can't trend what we don't track. And according to the American Heart Association, nearly half of US adults have high blood pressure and may not even know it. So they say high blood pressure is a silent killer because you won't not necessarily feel like have a bad headache or have all these symptoms. Blood pressure is something that can elevate And then you don't start to have symptoms until it's a lot further along in the process. Okay, so close this chat box here. Oh, I skipped this slide. Okay, so what does know your numbers mean? We're going to go over a lot of these things here. Blood pressure, uh, we know that one. We're going to talk about cholesterol. Many of you are familiar with cholesterol or lipid panels. You should be having those done depending on where you are. Some people every 5 years when you're a lot younger and you're healthier, as we age or numbers start to change or get out of kind of that normal range, we may check them annually. Blood sugars. So there's that random point of test blood sugar. We can poke your finger and see what it is in that moment. Sometimes we do labs called hemoglobin A1Cs. We'll talk about that and how that impacts your health. Our weight and our waist. So sometimes getting on the scale, we see the number like, oh, the scale is a lie, right? But sometimes it's not. And we need to take heed. And so knowing our height and weight, we come up with something called the body mass index, knowing what that number is, and also our waist circumference. Now, I wrote down some numbers here, and I actually don't know if I'm just gonna throw this out there because I hadn't thought of this in a while, but because we talk about BMI a lot, but for a woman, if our waist circumference is greater than 35, or for a male and our waist circumference is greater than 40, that sometimes is an indicator that there may be other things going on, or you're at risk for things like type 2 diabetes, high blood pressure, high cholesterol, coronary artery disease, insulin resistance. So numbers, right? These are numbers. You're like, I never knew my waist. Now, it's not saying that having a waist size equals that, but in our body of evidence, it suggests that people may be at higher risk for things. So something still to know, right? We'll talk about inflammation. You're like, how do we measure inflammation, Alice? I know what inflammation looks like, but we're going to get into some lab values, and some may have heard it. C-reactive protein. That's also very important to the heart, and also genetic factors. Well, what genetic factors am I looking at? Like numbers, this is too much, Alice. Well, there are things, and we'll get into those too, especially specific to around the heart. Like you may have heard these in the news. They're kind of starting to be buzzwords. Lipoprotein A. There's also cholesterol can be familial, right? So even though you wouldn't think cholesterol is a genetic factor, if high cholesterol runs in your family, that would be considered a genetic factor. But we'll get into a lot of that here. Numbers matter. You got to know them. And to know them, you got to check them. To check them, you got to go to your provider's office. So at a minimum, your annual physical exam. You might feel great. You're like, oh, I'm feeling good. Nothing's bothering me. You know, great. But we got to do a maintenance check before something happens. And when we do that, we can also detect things a lot earlier. So let's say you've never had high blood pressure, and then you have your annual visit, and it's like, oh, your blood pressure is a little bit elevated. Oh, and your hemoglobin A1C, your sugar, is also a little bit elevated. Like, whoa, 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 hold on here. These are the red flags you want to know. So we do screening. We want to detect early. So if we can detect that early, it's more of an option of, okay, well, let's assess the lifestyle. Like, how's your eating? Are you moving? Are you under a lot of stress? We can assess what might be going on here, right? Also reevaluate that family history to see how strong that really is. And maybe put in some less strenuous interventions. Like, okay, let's go, at lunchtime, I go eat my lunch and then I walk for at least 10 minutes after I eat because it helps to burn up that sugar. So I don't get sleepy after I eat. And it helps me to get in some steps. Rather that versus you not go, and I've seen this in the ER. Oh, granddad's as healthy as an ox. Well, granddad hasn't been seen by a doctor in 10 years. Now granddad's come in because he's had a heart attack, cholesterol through the roof, blood sugar through the roof. He is a little overweight and all of these things. That then requires a different intervention. But I bet you, and this is a conversation that most patients will say, if I'd only known, I would have done this. If I'd only known, I would have. So this is our opportunity to take those early interventions. We want to start prevention and treatment as soon as possible with the least restrictive, with the least invasive intervention so you can have a quality of life. It's not saying that, oh, I got to start medicines that's going to, be negative towards my quality of life. No, it's not. But I think we can all agree that, well, if all I had to do was eat a bowl of oatmeal versus now I have to take this statin every day, you have to do more than eat oatmeal. I'm just being very extreme here. many of us would have preferred the earlier option if we'd only known, but we only know if you go and get screened. Okay, so another question here. Which number do you check most often? So put in the chat box, what are you checking? Is it blood pressure, cholesterol, blood sugar? Maybe it's something else or none, nothing regular. Just curious, what are we tracking and trending in our current status? Okay, blood pressure. Okay, okay, blood pressure, blood sugar, those are the two most common ones. And sometimes those are the two easiest ones also. Um, All 4 times a year checkups. Very good. So blood pressure, blood sugars, I love that. I love that for everyone checking that. Those tests have been made to be easier for us because anyone can have a blood pressure machine at home or go to the local retail pharmacy and use their machine. Blood sugar checks for many people. Not saying you have to buy one or anything like that, but some people they have the blood sugar monitors. Um, those are all helpful. And some of you might say, well, I don't have a blood sugar monitor, right? And you don't necessarily need now those who are diabetic probably have them for more routine monitoring, but these have been methods to make tracking our health, monitoring our health a lot easier at home. So now there are some other things that we want to check that aren't as easy to check, like cholesterol. Now, usually that requires a blood test, right? Now, there are some devices that do the point of care, but wouldn't recommend those. Those are extremely expensive and they're not as reliable. And if they're elevated, we're going to tell you to go to a lab to get things done. But there are definitely other lab things we're going to get into and what to monitor and track. But I'll say, shown here on this pie chart I have, 51% of people monitor some type of health factor routinely, regularly. That's according to the National School of Healthy Aging, University of Michigan. Only 50% of people monitor something of their health regularly. 17% occasionally, 32% never or rarely. Now, if I never monitor something or I rarely ever do it, how can I really identify something early enough to do an intervention? Occasionally, that occasionally generally tends to happen when, oh, there's an issue or I don't feel well. There's a trigger to do that, or something has happened and maybe now I check it occasionally. But we want to swing that pendulum from being reactive, something's wrong, I don't feel well, to proactive, to let me make sure my car stays running, maintenance. This is when you check the tires, you rotate them because you want your tires to last long and you don't want any problems. So the regular monitoring is actually extremely helpful. Now we're going to get into some of these things that numbers we should know. So lipid panel. So when you get your cholesterol check, you'll see several numbers on your lipid panel. And understanding them empowers you to have better conversation with your provider, indeed. So just curious, how many people on here, you could just put yes or no, have had a lipid panel in the last year? Yes. Okay. Yes, yes. All right. Okay. Some said no. Okay. Now let's see. Let's break down these cholesterol numbers here. So, let's see. Did I do it? Okay, yeah. All right. So now I'm going to show a picture of this, but I just wanted to quickly go over them. So you have your kind of total cholesterol. Someone says, what's your cholesterol level? This is generally the number we give, right? The overall umbrella. And so that generally number is, we're looking for something less than 200. Now, caveat, if you're someone who has heart disease or you have high blood pressure or diabetes, you're overweight, then we might want this number a little bit lower, right? Because collectively, having those other conditions and a higher cholesterol can compound and exacerbate and put you at higher risk for things. So general below 200 is kind of a general everybody goal, but check with your healthcare provider. If you have these other conditions, you may want yours even a little bit lower. Okay. Now when we break it down a little bit more, I think many people have heard these LDL. This is loser. If you think that LDL loser, this is the loser cholesterol. This is the bad cholesterol, right? And we want to aim for less than 100. Now, if my LDL is a little bit is above that, is all lost? No, it's not. Because these numbers, and this is why providers look at these collectively. They look at the panel collectively because it's almost like a little give and take, like, oh, we're a little high here, but The HDL happy, that's the good cholesterol. The good cholesterol is really high. So that's kind of offsetting some of this, maybe the LDL being a little bit high. So we kind of look at things and and that's why you have to talk to your provider about what's right for you, right? So the good cholesterol, that's the only cholesterol we like to see elevated, is the one that helps remove excess cholesterol from the bloodstream. We like to aim for 60 and above, but if you're a little bit shy of 60, that's okay. Triglycerides, this is a type of fat. This is often related to the foods that we're eating too. Sugar intake, weight gain, and some of our metabolic health. And we want that less than 150. So here's a chart. It looks a little bit blurry, so I'm so sorry. I'll fix this in the slides that we can send out. This is kind of an overall chart, like desirable, borderline, and high. So obviously the goals that I just shared with you are in the desirable. We want something uh, you know, in those areas. And every lab will be slightly a little bit different, right? So it's important that you talk to your healthcare provider about that. So with that said, can I have a transparent moment with y'all? Is that okay? Is that okay if I have a transparent moment with y'all? I can't, yes? I can't see. Is everyone saying yes? I can't see the chat.
Yes, they're
Yes.
saying yes.
Yes. Okay. Here's my cholesterol levels, y'all. Okay. So I'm almost 50, just so you guys are just aware. So I'm almost 50. I had some excess weight on and I started exercising, eating healthier. And then I also saw these labs. So just some context. This was my first one. See, my cholesterol was over was a little high, triglycerides in the normal, and that's why you have to look at the normal labs. My HDL was good. We're not going to worry about VLDL, but it's a substrate of one of those. And then where'd that go? My LDL was on the high side. So I was like, oh my gosh, so this was maybe 6 months ago. I put some things in motion. I exercise and eating healthier foods, fish oil, like all the things, right? Fiber is also good to make sure to remove excess cholesterol because I was not eating enough fiber. Now, see, and so if you look at this when you're like, say, well, Alice, your cholesterol went higher, went to 209. And this is why you need to talk to your healthcare provider. Yes, my overall cholesterol went higher to 209, but my good cholesterol, my happy, went from 51 to 65. So that's good. So that kind of offsets that higher number. So that's why it's very difficult for anyone to kind of look at their cholesterol and say, this is bad, this is good. You have to look at everything in a bigger picture type of thing. So while the second one, like, no, your cholesterol's a lot higher. My triglycerides, they went down. So that's right, that we don't like high triglycerides. My happy cholesterol went up. Um, this VLDL, this is a bad cholesterol. It went down, right? And then even my LDL, it went down. So everything else went down, even though that total number went up. But when I talked to my provider, she's like, well, Alice, and I knew this too, but she's like, this is actually better. I know it looks like that top number. She's like, we could still do some things and bring it down, but it's still overall okay. So you got to talk to your healthcare provider because this can be very tricky. So that's why I wanted to show an example because I gave you this guideline of what's good and kind of what's desired, but I don't want you to beat yourself up and try to figure this out yourself. So I used myself as an example of how to do that. So there's a big picture of the cholesterol that you need to talk to your healthcare provider. You should never look at one number necessarily in isolation, especially without any medical guidance to that. Okay. Because we could potentially do some harm with that. And the way I see it is like, oh, my cholesterol number is down. I don't need my cholesterol medication. Someone stops it. And then they come back and their cholesterol number is back high. Well, you should never look at something in just one thing in isolation and make an intervention. Talk to your healthcare provider. And these numbers collectively, you look at them with age, blood pressure, smoking status, diabetes, um, weight, all of these things play a factor. So if you have these other things, we actually might need to be tighter in some of these areas, like I mentioned before. Now, there's some additional tests, right? Because before I mention what these additional tests are that can give us some insight to your heart health, has anybody heard of them? And if so, just drop them in the chat box. I'm just kind of curious because they've been going around on Facebook, Twitter, TikTok. People are talking about, oh, you should get this test done. And if not, that's okay. Let's see. Okay. EKGs are important. Those tell us about the electrical conduction of our heart. That's it. So after a certain age, you should have an EKG done annually, and especially if you've had any heart conditions or were concerned about heart disease. Okay, vitamin D is good. That's also a good one to know, but I'm going to talk about three very specific tests. Now, this is the one thing if anything, I want you to take away and talk to your healthcare provider about from this presentation about your heart health. We know cholesterol, we know hemoglobin A1C, these three cardiovascular tests, they are generally covered by Medicare insurances, and especially if you have high blood pressure or diabetes, and or if you have a family history. So these are three tests that if you've not had these done, if your healthcare provider has not talked to you about them and you want to know what's going on, like your heart, what else, it's not they are additive tests. It's a simple blood test. So when you get your other, maybe the next time you get your cholesterol, it's like have them add this onto it. Now, this is the lipoprotein A. This tells us more about genetics. So let's say I exercise, I eat healthy, I don't smoke, I don't do all those things. I still got heart disease. What happened? Well, especially if there's strong family genetics, we can see this. You can be looking healthy like a horse. If we check a lipoprotein and it's elevated, we know that you're at higher risk for heart disease, even though you've done all the things. Wouldn't you want to know this? Wouldn't you want to know this? Like I'm doing all these things, but and truth is sometimes we don't know our family history as much as we do, maybe once did because people aren't talking, they're texting. Who go figure. But um uh, the American Heart Association notes that elevated LPA affects about 20% of the population. And so if you're not testing, and I'll say this is not a standard test. This is not a standard test. Your doctor is not going to necessarily recommend this unless there is some concern about your cardiovascular status or you've gone to a cardiovascular or cardiology doctor. So, but your family practice doctor or a nurse practitioner can order this on an annual exam. There's also apolipoprotein B, ApoB. This measures the number of cholesterol particles that can enter artery walls. So this helps us to better identify of the cholesterol that you have. Like for example, my cholesterol number was like 209. It's like even though everything went down, if you look at that one number, it's like, well, my provider and I had the conversation like, well, overall, most of the numbers went down. That number went, your overall cholesterol went up a little bit, but we're going to attribute it to the higher cholesterol. That's great that you can attribute to that, but I want to know for sure of that higher cholesterol, how much of those particles are going to stick to my artery walls. So I want to have this test done. So I will say this, lipoprotein A is probably a test you only need done once in your life because it's genetics. Once it's there, it's there. There's no really improving that one. The ApoB, you can improve that with diet, exercise, and medicine and lifestyles. C-reactive protein, this is how we measure inflammation. Remember, I was like, we looked at something like, oh, your arm is inflamed, or we see something swollen and red. We can't see that inside our vascular walls. So you do a C-reactive protein. This is a marker of inflammation in the body and most specifically your cardiovascular walls. And I learned this I was very fortunate. Right when I entered nursing, there was a Black cardiologist, and there was this gentleman who had had a heart attack, and he was having heart attacks, and then everyone else would check him out like, oh, all his numbers look good, he's fine, and we didn't have lipoprotein A then, but we did have C-reactive protein. He said, Alice, run a C-reactive protein. We ran that back. He says, and it was like sky high. And he's like, there you go. That's the reason. He's going to be a continued risk for heart disease. Even though he's doing all the things and everything looks normal, he needs to make sure that they run a C-reactive protein because we need to everyone's like, oh, he didn't really have a heart attack because he doesn't have the risk factors. He had inflammation. So then it sent the providers down a different rabbit hole to try to understand why is he having inflammation in his body? Because it wasn't diabetes, it wasn't high blood pressure, it wasn't cholesterol, it was something else. It would end up being some type of immunological, like immune disease, but it was putting him at risk for heart attacks. So that is not a standard test that's done. Now you're like, Nurse Alice, these might be excess tests. You know what? When you're having your annual physical and we are on the side of maintenance, and especially, I would say this, 20-year-olds probably don't need to have these done as often, maybe periodically. But once you are of a certain age, and I would say, and not that personally because I am turning 50, but I would say, and especially other conditions like perimenopause, menopause, other things are happening in our body. And with today's level of stressful things happening in our nation today, Stress can also cause elevated C-reactive protein. So these three particular tests, if you've not had them done before, I would ask that you talk to your healthcare provider about, have I had these done? Can we run these the next time I have a test, just so you have a better picture of what's going on? And just to share with you, I did that very thing. I had a lipo A protein to see because my dad died of a heart attack. My mother and dad both had high blood pressure. I wanted to see what my how strong genetically was my cardiovascular risk, and it was normal. So this is something that I probably never have to have done again in life. The apolipoprotein B, this is one that I can improve with diet and exercise. So I'm at 85. Desirable per this lab is 90. That's good, but to me, that's too little too close to 90 for my liking. So I'm going to keep on going. But it gives me some idea of my cardiovascular disease risk, right? So there we go. So there we go. And then C-reactive protein, my inflammation. Okay, inflammation, not too bad. And then I'm going to look at I just threw in hemoglobin A1C in there just because even though that's something that we track and trend, in the scheme of this, because I wanted to know my cardiovascular risk, we threw in the hemoglobin A1C, and I was here in the uh, glycemic. I have glycemic control, so and so this, because there's one thing I also say this: I'm a healthcare provider, but I'm a patient too, and sometimes I've seen it, and I hope I've never been and don't ever want to be that provider that tells patients and people to do something that I can't do myself. And having that transparent moment. I'm not 100% immaculate in my health as well, right? Health is a great equalizer. I don't care if you went to Princeton, you went to Harvard, or you didn't graduate high school. Health is a great equalizer, and there's an opportunity for all of us here because it impacts us all. So I know I went to a little more detail about these type of labs, but just curious, have you ever looked at any of your cholesterol or lab results and felt unsure about what they meant? Um, did your provider talk to you about them and explain it to you in a way where you felt satisfied with understanding what it means for you and next steps? Yes. Okay. Sometimes, okay, Karen, sometimes. Yeah, Judy, yes. I will say this. Sometimes providers can make us feel rushed, right? We get there, we're on time for our appointment, they're late. And then we get in there and it's like rush, rush, rush. And it's like, wait a minute, how did this happen? But you are entitled to your healthcare provider explaining to you in a way that you understand, in a language in which you understand, providing materials in a way that is best suitable for your learning style so you can understand. Because if if there's confusion or uncertainty about a lab result or what that means, how does that help you to make the next best step? We don't want it to be like, well, the doctor ordered it, the nurse practitioner ordered it. We want I strive, and colleagues, and I hope that most of medicine, although we know that there's not because we've seen it, there are some people who don't take the time to do so, but you're entitled. So um, ask, please ask. Um, Make sure you ask, well, what does this mean for me? What does this mean for my lab test? What should I be looking out for? When's the next time I need to take this test? And I will say this because I get asked a lot about cholesterol. When someone has any type of element in their cholesterol level that's elevated or trending in a direction we don't want to see, and we'll say, okay, you know what, we're going to either change your medicine or try diet and exercise. We'll come back and retest. Well, what is that retest window? No sooner than 3 months because it takes about 3 months for any changes to really show up in your cholesterol level. But make sure you ask that information because it might be um not that cholesterol will come back any sooner than 3 months, but some might say, oh, well, I'll wait till next year. Do you really want to wait a year? If you've had new high cholesterol or it's not being managed on your current regimen and there's a change, do we really want to wait a whole year before I find out if this is working or not? Oh no, a lot can happen in a year. So it's important that you ask your provider. We want you to feel empowered. We want you to understand this. Sometimes that looks like the provider explaining it to you. Maybe the nurse follows up and has more detailed conversation with you. Maybe it's in some printed materials. Maybe it's in a video that they should refer to you, but it should be in any of those forms that are in your language in a way that you and in a format in which you best understand. And don't feel like you're asking too much. Please don't feel like you're asking too much. It's actually there. That information is actually presented to us as healthcare providers, in which we're supposed to provide it this way. But sometimes they just give you what you give you. But this is where we want you to feel empowered. Now, blood pressure, we talked about this a little bit, silent killer. Nearly half of Americans have high blood pressure, um, and they don't know it, or they don't necessarily take it serious. They're like, oh, my blood pressure's not high yet, high enough. I don't have a headache. You wait till you have a headache. Please don't wait for that to happen. The American Heart Association and American College of Cardiology just updated some of their categories of high blood pressure. And part of this was to help with some of the um, language to help with some of the urgency because I will say this. What is a normal blood pressure? What is a heart healthy blood pressure? If someone could put in the chat box, let me know what you think that is. What is a heart healthy blood pressure? Let's say 120. Oh, okay. All right. Okay, so y'all see this green here? So the top number, systolic, that's when it's systole, when the heart's contracted, everything's, the pressure's highest, is less than 120. So really that would mean that top number is supposed to be 119. I know you're like, wait a minute. When did that change? Well, it just changed last year. So really 119 and less than 80. So that would technically mean a blood pressure of 119 over 79 is a normal, quote unquote, normal blood pressure. Now I'm saying, I see my air quotes, that's because depending on other medical conditions you may have, there are some instances where we want the pressure to be higher, especially for someone who has maybe have like renal stenosis or some kidney disease or on dialysis. Sometimes we need that blood pressure a little bit higher. So please just know you got to talk to your healthcare provider, okay? But that 120/80 that we used to know as like the golden standard, that's now considered elevated. Look at that, won't you? 120 falls into the elevated category. And then actually, if you have a bottom number of 80, you actually are stage one hypertension. Now, isn't that crazy? And I'm saying this because some of you might like clutching your pearls, like, wait a minute, what do you mean I have stage one hyper? I'm not diagnosing you. This is a guideline. You need to talk to your healthcare provider and get a series of blood pressures to make sure that this is a pattern for you. But it's important to know this because you wouldn't know this if we didn't talk about it. And this is how your healthcare provider is looking at it. Whether they say it or not, this is how it's getting in the documentation. This is how health plans are looking at it. This is how insurance is looking at it. This is how your life insurance, when they go in to see, like, should we insure this person? What's their blood pressure? Oh, no, they have this. These are the metrics that are being used. So also these are also what help guide um, the kind of standard medication guidelines. Now, your provider can, do things based on your individual situation. But if we looked at standard guidelines, it's like, if this, do that, if this, do that. If someone was sticking strictly to the guidelines, your regimen might change. Now, does it mean your regimen needs to change? Not necessarily, but maybe does need to change for the good, right? Especially if you've had a provider who's been, and I'm gonna say it, I've been in nursing for over 25 years. Some of the things I learned when I first entered are not the same now. Like this is definitely new, right? We used to not be worried about a blood pressure until someone was 140 over 90, right? Then we said, oh, high blood pressure. But now 140 over 90 is stage two. So there's all of this. So this is important to know what your numbers are because when you know what your numbers are, and this is American Heart and American College of Cardiology. So based on the experts, the science, the evidence, and the medicine that's out there, this is the guideline used to categorize your blood pressure and what you should, this should help guide what you do or do next. And again, if you have other medical conditions, diabetes, overweight, smoking, high cholesterol, those things all play a role with your heart health as well. Okay, what would a blood pressure be considered too low? Well, too low, that's interesting. There's a generic number where that systolic number less than 90, right? Less than 90, but that's like a catch-all. Sometimes, and I'll use a real example. So I've had people that I've taken care of, their blood pressure normally runs 140 over 90, right? But they're on dialysis. They have lots of renal stenosis. They have other things going on that's happening. When their blood pressure drops to 110 and they feel a little dizzy, that's too low for them. So, Strat, that's a difficult question to answer. So that's why you got to talk to your healthcare provider about what's too low for me. And actually, you should ask that question, especially if you're someone on blood pressure medications. Ask your provider, what's blood pressure? What's a too low blood pressure or too low of a heart rate where I should not take my medicine that day? Don't wait for how you feel because you might feel fine, take the medicine, then it's worse. So ask that number to your healthcare provider based on especially your clinical picture of what else is going on with you. That's a great question. Silent damage, the heart works harder, organs receive less oxygen, it puts you at risk for heart attack, for stroke, the arteries stiffen. The heart is working overtime and it's already working around the clock. No breaks, no breaks. Not a 10, not a 15, not a lunch, not a nothing. And so, but it's because it has a very, very important job. It's pumping oxygen-rich blood to all the organs of the body. And when the heart does relax for that split moment, right? You saw the systole, which is the top number, and diastole. Diastole is when the heart relaxes, but it relaxes so it can fill with more blood, and then it contracts systole so they can pump the blood everywhere. The heart only gets its share of blood when it relaxes in diastole for that split second. So we don't want the heart to work so hard because if the heart has to work so hard, it becomes stiff. It won't be it will have it restructures in shape so the chambers can't fill as much. They get stiff. Or maybe the heart's working too hard and your heart rate's too high. There's not enough relaxation time for the heart to fill during that relaxation. So understand high blood pressure comes at a toll. There's a lot going on. Um, it's almost like when you plant a seed. Now, we think of planting a seed as a beautiful thing. I plant the seed, I'm watering it, sunlight, day one, nothing. Day two, nothing. Day three, nothing. Maybe not whole week, nothing. But then on day eight, you start to see a little nub come out the dirt. Oh, it's like, oh, the plant, it's growing. Same with the damage of blood pressure. You don't see anything until it's reached a certain point, but it's already been brewing. Okay. It's important to do accurate blood pressure monitoring. Um, so if you're someone who does have a blood pressure monitor at home, these are just some tips on how to accurately take it. Sitting quietly, coffee, caffeine, smoking for at least 30 minutes beforehand. Sitting with your feet on the ground, relax, arm out on the table, not hanging downwards. And then, maybe getting 2 or 3 readings, each 1 minute apart. And so when I said, if you saw that chart, you're like, oh my gosh, I have stage 1 or stage 2 high blood pressure. Please don't judge it based on that one reading. You need to take a series of readings and not just one day. There's house I did 3 readings, 1 minute apart, and I got high blood pressure. Let's maybe check it later in the day or the next 3 days, something like that. Now, I will say this. Let's say you had your annual physical and your blood pressure was fine. It's like a selfie. You take a picture and it looks one way, but then as soon as you take another selfie, maybe your hair moved a little bit. So your blood pressure can be labile, right? Maybe so it's important that when you go to your provider, you get that one blood pressure, but then, don't be afraid to take it at home, take it at the retail store, different settings, because we want to see like overall, how's your blood pressure doing, right? But it's important to get accurate readings. Now, someone have asked, like, what do you think about those wrist monitors? And what about, the arms, the ones you buy in the store? I would say this, knowing your blood pressure versus not having anything at all is way better. I would rather you have the arm one because of its location is probably more accurate, but the wrist cups, as long as you follow the instructions properly with your positioning and these type of things, those should be pretty accurate. But if it's elevated, meaning it's higher, then let's recheck it with a manual. Have a healthcare provider check it with a manual arm read. So these small choices can lead to really big benefits. The National Institute of Health shows that lifestyle changes can be as effective as medications for some people with high blood pressure. So, but I know it's harder. To be honest, some people are like, I would rather take a pill because I don't have time to exercise. Eating healthy takes up too much time. I don't have enough money. It's much easier. Well, for every, even with taking blood pressure medications, they they're good for your blood pressure, but they have side effects, right? And I'm not saying don't take your blood pressure medication at all, but what I'm saying is these, the first two things that a healthcare provider should prescribe to you when it comes to your heart health are diet and exercise. And legitimately, have them write it down on a script pad because some insurance companies do reimburse for nutritional services for a nutritionist. Maybe your doctor can write a referral to a nutritionist so they can help you with easy meal planning. Or sometimes they'll cover a gym membership. Um, if it's prescribed. So write it, have your provider write it down. Now you're like, I know in today's climate, you're like, oh, that's not going to fly. You know what? It actually does fly because there's so much red tape and some places have put barriers in place. But for the most part, you won't know if you don't try. And I do it for all my pay, all the people I take care of. Like, listen, I'm gonna go ahead and write this, prescribe it to you. Let's see how it works. Let's see how it goes. Insurance might give a little pushback. Okay, let's write an indication of why you need this. And then, hopefully that moves forward. But diet and exercise really, they're the two things that are not only just going to fix your heart health, because it's not just about your heart, but and we had a presentation a little while, was it last session, about functional fitness, about aging gracefully and as independent as possible. Taking a blood pressure pill, while it's helpful for your heart health, won't necessarily help you if you fall down and you can't get back up. But exercising will. That'll help you, right? Um, so some of these small changes, and it doesn't have to be major and drastic, but maybe if you're someone like my thing, I don't know if y'all know, but I used to weigh like 185 pounds. I was borderline high blood pressure, blood sugar. This is even a while ago, and I was a lot younger. Um, I was eating, listen, I don't see a lot of Burger Kings anymore, but I love me a Whopper. And so I would have Whoppers like 3 times a week, like Whopper, extra double Whopper, French, like the soda and everything. And so I cut down. I was like, okay, I'm gonna have a Whopper Junior, no sauces, no cheese, and I'm gonna have a diet soda. Now, I'm not promoting that as the healthy meal, but I took baby steps so I was able to wean that out because I want you to enjoy life. Eat, and we gotta enjoy life while we're here too, but in moderation. Okay. You don't necessarily like exercising. You don't necessarily have to go to a gym, but you know what? Okay, I just had breakfast. Let me just go walk around the block for 10 minutes. After lunch, let me go walk around the block for 10 minutes. After dinner, let me walk around the block for 10 minutes. Boom, you've got in 30 minutes of cardio and didn't even know it. Because there's lots of evidence that say lifestyle changes are just as impactful, if not more, because they help you with so many other things, right? Again, that quick fix that people are looking for that blood pressure pill, is that really going to help you with diabetes? Is it going to help you with insulin resistance? Is it going to help you with inflammation? Is it going to help you? So diet and exercise, moving more daily, eating more plant-based diets, lean meats, reducing your sodium, managing our stress as much as we can as possible in today's age. I know we're all stressed out here. You see these grades that are happening. I feel like they just popped up this year. Maybe it's my kids. Improve sleep. Sleep will do it. Sleep is actually so important for inflammation. If you don't get enough sleep, you will be chronically inflamed, just FYI. So make sure you get enough sleep. And then taking your medications as prescribed. So nothing in here in this presentation says stop taking your medications based on a one chart that Nurse Alice showed me. This is all information to help you kind of better understand some of these things so you can go back and talk to your healthcare provider about your numbers, your medicines, and finding that perfect recipe for you. Listen, these small, consistent changes, if you were to change a little bit of what you ate, let's say you cut out the Whoppers and you're able to cut down, I don't know, 500 calories a week, and you added walking to your regimen, you would start to lose weight. Now, it's not going to be drastic, like, or anything like that. And it's not like the weight loss injectables, but it's healthy, it's sustained, and it's consistent. You will actually see benefits of not only weight loss, but improved endurance. You'll see blood pressure drops. Sometimes diet and exercise alone can drop that blood pressure. And I've seen people, not in all cases, but some people who've been able to no longer have to take their blood pressure medication because they lost the weight. or they may have been able to eventually come off of their cholesterol medications, or at least decrease the dose of their cholesterol medications because they've made small, consistent changes. And let me just say, cholesterol isn't just foods, it's exercise too. Okay. A 30% risk reduction also in lower heart disease with regular activity. And again, like I said, losing that weight. Losing 10 pounds can reduce your blood pressure up to 20 millimeters of pressure. So when we saw that chart, if some of you are like, wait a minute, how did I end up in the orangey red area when I used to be green or yellow? Try losing 10 pounds and watch you go back into that green. I've seen it. I've seen it and I've done it with some of my numbers myself. So what feels most realistic for you? Let me ask this question. Out of the things that we've chatted about for heart health, all of these things for understanding what our numbers are, these tests and things that we can do to help improve our heart health. And I didn't go a lot into smoking here, and smoking or drinking and those type of things. What I focused on here are the things that you should do, right? Some of the but I will let me do say this that if you do smoke, I would encourage you to stop smoking. The day you stop, even if you've been smoking for 20 years, makes a huge difference. It does. And alcohol definitely in moderation. But which of these things feels more realistic for you right now? Oh, and let me see what other questions we have here. Um, let's see. While you guys are putting that chat, let me go through some of these questions I may have missed. Okay, we talked
Yeah.
about blood pressure. Okay. Oh, so what about pulse rate? Bernice, a heart rate, if you're someone who's otherwise generally healthy without any chronic medical conditions, we generally use 60. If your heart rate's below 60, we call that bradycardia. But if your heart rate's below 60, we want to know, well, why is your heart rate below 60? Is it medicine? Are you a trained athlete? Some of that affects. And then on the high end, we'll say a heart rate can go up to 100. But if you're in the 90s and 80s, a question I have is, well, what are you doing? Are you stressed? Are you anxious? Are you nervous? Because a general resting heart rate generally falls between 60 and maybe high 80s. So if you're higher than that, then I would be questioned. Okay. What are your thoughts on weight loss injectables? I think weight loss injectables definitely have their place and help kickstart the weight loss journey. They need to be done with guidance and should be done alone. Weight loss injectables with uh, food moderation and exercise, and then also sleep. And then I also will offer to people that I take care of a mental health referral because there's something around the eating, whether it's depression, sadness, loneliness. Sometimes those things can contribute to that. So I think weight loss injectables are a great jump starter, but should be a tool in the toolkit. Now, how long you stay on them, that's a little questionable and will depend on this situation because there are some tests that you need to do, especially checking for like thyroid cancers while they're on there and any other type of nausea or abdominal pain. So it'll depend. That will determine how long you should be on it. Okay. Moving throughout okay. So what changes do you feel most realistic about? Moving, eating healthier, working harder for weight loss. Okay. Managing stress better, monitoring my numbers. Okay. Good. All of them. I like it. Better sleep. Okay, very good. Okay, that heart rate's pretty good, Bernice. And weight loss. Okay, so I want to say, someone said it here well. Better diet, sleep, and moving more. So the interesting thing is, if you move more, um, you'll burn more calories, you'll lose weight. Hopefully, if you accompany that with good food to fuel your body, it'll make you feel better about exercising. Your numbers will go down, and because you're moving, you're going to be so tired you're going to sleep. So that it's actually that's kind of like the triad, if you will, of really healthier living. So there's no single right answer. Monitoring also is important. So you can't track what we don't trend, or we can't trend what we don't track. So, but I want you to monitor your health with confidence, checking your blood pressure weekly, or if it's elevated, maybe same time every day. Now, if you're someone whose blood pressure is always normal, then you can reduce that frequency. Cholesterol labs, they do typically 4 to 6 years at a minimum, but usually by the time of And we're seeing that because of family history and because of hypertension. So many people have high blood pressure, and so many people are overweight, and with diabetes, all those things raging. We've actually started to do cholesterols every year for many people. So again, don't fixate on one number or one reading. We're looking for patterns, and make sure you're talking to your provider along the way so we can figure out what's good for you. So monitoring provides awareness, not anxiety. Okay. So don't get anxious and drive your blood pressure up. Okay. We're monitoring because we're looking for early identification. So let's just be mindful of that. Continuous monitoring um, helps us lead to informed action, which increases our awareness and hopefully leads to better control. So talk to your provider about screening. What do your numbers mean? What should my goal be? And also, do I need lifestyle changes, medication, or both? Okay. Now, so your health journey starts today, guys. Now, I know you guys have been on a journey, but I'm hoping that today we will all recommit to ourselves. And it's not just to ourselves, but to our significant others, to our kids, to our grandkids, to our friends, to our church members, to our community friends, because you being healthy is good for you, it's good for them, and what you do can inspire someone else to start their healthy journey as well. And it starts with this kind of knowledge, this kind of community that we've built um, but understand you're not alone in this journey. Will there be obstacles? Absolutely. Will you stumble and fall along the way? Absolutely. But the most important thing is that you pick yourself back up and then you keep going. Okay. Heart disease is common, but it can be managed. Knowing your numbers is where we have to start, and making those small, consistent lifestyle changes can mean for long-term benefits. Okay. And hopefully today's conversation has inspired you to do more regular monitoring and have confidence when you talk to your healthcare providers. So thank you so much for participating in today's conversation. Your heart health really matters. So I'm hoping whatever you learned today, even if it's just a little nugget or maybe it's a big nugget, that you talk to, next when you're at the dinner table with your friends or your family, talk to them about what you learned today. Maybe you can do this. It's always easier when you have a partner to do this with, to help each other hold accountable. Or if you're part of Soul Steppers, we hold you accountable as well. And if you're not part of Soul Steppers, you can join us every month here for another Healthy Living series with Nurse Alice. But together we talk about different things to help you to talk, empower you to talk to your healthcare provider so you can personalize a plan for you that'll help you live a happier and healthier life. So that concludes today's presentation. Thank you so much for sitting with me. It was my pleasure. And then listen, don't go anywhere, okay? Because if you missed last month's presentation, I believe that's available on replay. And you'll definitely want to join us next month as well as we get into gut health and talking about colon cancer prevention. You might have seen that the recent, and I'm sorry, I'm still going blank on his name. It was just on the tip of my tongue. From he passed away of colon cancer. And many of we not that it's just celebrities, but we think of colon cancer. People are actually getting diagnosed earlier and they're dying earlier from colon cancer. So there's a lot to be said about when to start screening, getting that colonoscopy done, how fiber and our diet impacts that, and so how we can be healthy from the inside out. So registration's free. You see the QR code. Sign your friends up too. They should come. They should. Yeah.
Thank
So,
you, Nurse Alice. So much information. And also, just as a reminder for everybody, Nurse Alice put up the slide for the next session. There's a QR code. You can register there. You can also look at previous sessions on the AARP YouTube page, AARP California YouTube page, as well as we have a blog page for the series as well, where the prior recordings are there, as well as the future sessions that are coming up for the rest of 2026. So you can register for March, April, May, all the way to December if you choose to, and share them with other people.
yes, please.
Yes, yes. Thank you so much, Nurse. And I'm just gonna give her a big shout out too for the transparency. Putting your numbers up there, that's some courage. And it's great for folks to be able to see that from someone like yourself who is a medical professional and you're providing your numbers and talking about what they mean for you. And it's a great piece about making sure that um you talk to everyone here, talk to your doctors. Everybody's situation is different, and those numbers mean different for each person. So don't go by just, one person's numbers or what your wife's numbers or your husband's or your cousin's numbers are. You need to go by what your numbers mean for your body and for you.
Thank
So thank you, Nurse Alice, so much. Appreciate it.
you. Thanks everyone for joining. It's my pleasure. I'll see you guys next month.
See you all next month. Bye bye.